Steffany, would you like to talk about experience as an NCCAM F31 trainee?
I hadn't prepared anything as of yet, but I can certainly go off the cuff and share my experience.
Yeah, please.
So what I would say is, now this is going back some years, but I think that the challenges that I had are, am I breaking up to you guys because it seems like it's choppy on my end?
No. That's okay to me.
Okay, great, then I'll continue. I was in the situation of being a CAM, as we called it at the time, researcher in a more medical environment without any real support. Or, you know, the same situation that you have when you send a proposal to NIH and they don't understand your discipline. I was in an institution that didn't understand my discipline. So I was getting a PhD in public health at Johns Hopkins Bloomberg School. And while they were very interested in mind-body practices and the use of mind-body practices as a public health intervention, they didn't have any understanding of CAM at all, not just my particular discipline, but the entire field and the existing literature in the field, and you know, even the philosophy, the mechanics, any of it. So what ended up happening for me, the reason why I started as a research assistant in Johns Hopkins rheumatology, largely because someone in the rheumatology department had taken a yoga class and had interest in pursuing it, although she had no background in yoga or yoga research. And she brought me in as a research assistant, and we created a little pilot study, which then ended up being my dissertation. And at a certain point, we decided to apply for funding from NIH to support the dissertation research. So I was in Johns Hopkins Medicine as a research assistant and Johns Hopkins Bloomberg Public Health School as a student. And between the two institutions, I had a lot of guidance about how to conduct research, but I had no guidance about how to conduct research from a CAM perspective. And nor did I have any. I had training as a yoga therapist, but not as a yoga researcher. And my first application to NCCAM, which it was at the time, I was rejected for that reason. So they felt as though the project was strong. And I think that the project was strong because I was able to use my understanding of yoga along with their understanding of research and somehow figure out how the two had to work together. And there was very little in the literature at the time. But it's a training grant, which means that not only are you executing a project, but you also have to be trained. And their concern was that there was nothing in the proposal to suggest that I was going to emerge as a CAM researcher specifically. Rather, I was going to become a researcher trained at Johns Hopkins in research, design, and execution, having happened to do my dissertation in a CAM area. And so they asked me to resubmit and to demonstrate to them how I was going to get training as a CAM researcher. And I had to hobble that together through opportunities that were outside of Hopkins because there was nothing at Hopkins that was available in that regard. Now there's a mind-body group, and there's some CAM stuff going on there, but still very little. So I ended up going over to University of Maryland and taking a couple of courses there just to supplement my education. I ended up getting further training as a yoga therapist, which was outside of any sort of academic setting. And And then I went to a bunch of conferences. I joined the special interest group on CAM at the American Public Health Association, and I resubmitted the proposal with that additional outside training, and they accepted it at that time. So I then had the funding from NCCAM, but I still didn't have the institutional mentoring. And so I felt as though when it came to anything about how to, the particularities of how CAM research is different from other kinds of research, I just had to figure that out on my own. Now I'm at a CAM institution, and I feel like there's the opposite problem. So there's a whole bunch of understanding of integrative health and all of the professions and the philosophy and the unique challenges without the very strong research infrastructure and mentoring and support that a place like Hopkins has. I think that this opportunity for pairing of institutions has a lot of potential in many ways. We've been talking about pairing faculty at integrative health institutions with research-oriented institutions that can help to provide some of the infrastructure that's lacking at the integrative health schools. But I also think that there are siloed researchers interested in integrative health at these research institutions who need the opposite. And I think that the same is true not just for the faculty, but also for the students. So there are students at integrative health institutions that are lacking the strong research methods that they're looking for, and there are students at strong research institutions who feel very isolated in their CAM pursuits. And with that, I will answer any questions that anybody has about my particular experience.
Thanks, Steffany. I think my experience in doing in research training is pretty, kind of parallel yours, pretty similar. Started, got mentored and trained at a conventional, academic medical center, and now I'm in an integrative health university, and same pros and cons in both locations. I guess I would just issue a little cautionary note about partnerships between an academic medical center and an integrative health center. Really, to be a really fruitful relationship and a good idea. One of the comments I got back on a recent grant application was that the partner institution that we proposed, which was, really great in many ways, looked really great, happened to be 3,000 miles away, and some of the reviewers thought that was a disadvantage. So if you given a choice, if you can find an institution to partner with close, kind of this geographically close by, it'll probably be seen as an advantage.
Well, I would also suggest, because I think a lot of times at integrative health institutions, we think about us needing them, that, in order to submit a strong proposal to NIH, we need to partner with an institution that has a lot of research infrastructure and history of funding. But I think that they also need us. When I was developing my intervention and, what were the appropriate measures and how was I even going to write about it, I was totally on my own. And so I think we as integrative health faculty can provide something of value. There are also students in the medical school at Hopkins who want to do rotations in our clinic because there's just nothing available for them at Hopkins to understand these modalities. So I think we should also look at what our value is in the relationship.
Absolutely. Do you think that that's recognized, you know, at the other end by the conventional medical centers? Kind of, do people recognize that need, or do
Well,
they the only ones that recognize it?
No, I think that the people who are interested in it recognize it. But there are plenty of people who have zero concern about our disciplines and, you know, don't see the value, don't think that there's sufficient rigor, et cetera, and then we do not appear valuable to them. But for those who want to understand our disciplines, yes, they recognize our value.
The one thing I would add to it, and I completely agree, is the idea of paired is that ideally these become what I call equal partnerships, meaning that the decision-making process is done by co-PIs. They're co-PIs that are listed. We're now developing a course with a consortium, and part of it is that there will be 2 faculty, one from our discipline, you know, one from the conventional medicine. You know, we're writing it up so in this situation we're able to do it because it's a consortium and the collaborative, but 2 equal partners in all ways, including the economics. So I think as much as possible that we move towards that. I think that, you know, benefits, it kind of is our own statement of value, and I think strengthens our own disciplines as well.
I'd like to add a point to this as well. This is Nikki. That I hear a lot of the discussion around schools of medicine, but that it might also be of interest, and it might in some cases be a little bit easier, particularly to get that more equal partnership pairing on lesser schools, but schools within still big research institutions. So for example, I'm in a smaller school, the School of Health and Rehabilitation Sciences, on the IU campus, that of course the big dog on campus is the School of Medicine. And even within schools within the university have a really hard time getting equal footing with partnerships with the School of Medicine. And I think that if we take a track, or if we also have an eye on tracks that are still within the research infrastructure, but that might be in disciplines that would have the patient access and the client access would be through the practitioner side, I think that might be a really fruitful partnership as well. And without all of the rigmarole of the politics of schools of medicine.
I'll also add that we've been doing a fair amount of this because there are a lot of medical schools around us, and even if they don't immediately see our value on the research side, they do see it in offering an added service for their patients. So we have in some cases been able to arrange a relationship where we provide services for their patients who are really looking for these opportunities, but it's simultaneously a clinical agreement and a research agreement. So we'll provide trained clinicians who will come to your clinic and offer acupuncture, et cetera, to your patients who are interested, and let's collect some data and work on a project together that's going to benefit us mutually as well.
Okay. Hey, any other comments on? Thank you, Steffany.
My pleasure.